Hello everyone, and welcome to this focused microlearning session. Today, we're going to sharpen our understanding of potassium imbalances. We'll explore the critical differences between hypokalemia and hyperkalemia, highlighting key concepts and NCLEX priorities. This will help you feel more confident in patient care and your exams. Let's get started. Potassium, or K+, is a vital electrolyte that acts as the body's electrical conductor. It plays a crucial role in regulating our heart rhythm, ensuring our muscles contract properly, and facilitating nerve signaling. Think of it as the electrical wiring that keeps everything in sync within our body. If there's an imbalance, whether too much or too little potassium, it can lead to serious, even life-threatening consequences. That's why maintaining the right potassium levels is so essential for our overall health and well-being. Throughout this presentation, we'll see how electrolytes like potassium are fundamental to our body's functions. They're not just chemicals, they're the electrical signals that keep us alive and functioning smoothly. Let's take a closer look at some less common but still important causes of hypokalemia. While inadequate dietary intake of potassium isn't the most frequent cause, it can contribute, especially in individuals who are malnourished. So, maintaining proper nutrition is key. Next, conditions like Cushing's syndrome or primary hyperaldosteronism can lead to increased potassium excretion. These endocrine issues cause the body to lose more potassium than normal, which can result in low serum levels if not managed properly. Medications also play a significant role. Diuretics, particularly loop and thiazide diuretics, are common culprits. They increase potassium excretion through the kidneys, so patients on these drugs need monitoring to prevent hypokalemia. Lastly, fluid loss from excessive vomiting, diarrhea, or gastric suction can lead to significant potassium depletion. When the body loses a lot of fluids, it also loses potassium, which can quickly drop serum levels. Understanding these causes helps us recognize the importance of early intervention and prevention strategies, especially in vulnerable patients. Let's start by talking about fatigue and lethargy. Patients often report feeling generally tired, sluggish, and experiencing muscle fatigue. This happens because of impaired nerve and muscle function, which is a key aspect to monitor. Recognizing these symptoms early can really make a difference in patient care. Next, we see gastrointestinal issues. Decreased bowel motility can lead to constipation, abdominal distension, and in more severe cases, paralytic ileus. These symptoms highlight how electrolyte imbalances can affect the entire digestive system, so staying alert to these signs is crucial. Moving on to muscle weakness, patients might experience leg cramps or a more generalized weakness. In severe situations, this can progress to flaccid paralysis or even weakness of the respiratory muscles, which is a serious concern. It underscores the importance of assessing neuromuscular function closely. Finally, let's discuss cardiac irregularities. Symptoms like palpitations and arrhythmias, such as flattened T waves or prominent U waves on an EKG, are common indicators. These are particularly important because they can increase the risk of digitalis toxicity, so vigilant cardiac monitoring is vital. Overall, recognizing these signs and symptoms of hypokalemia is essential for timely nursing intervention. Detecting these early helps prevent more severe complications and supports better patient outcomes. Let's talk about potassium supplementation. For mild cases of hypokalemia, oral supplements are usually sufficient and convenient. However, in severe cases, intravenous potassium may be necessary, but it's critical to remember that IV potassium should never be given as a push. This is because rapid administration can lead to serious complications like cardiac arrest. Always administer IV potassium diluted and at a slow rate to ensure safety. Moving on to dietary management, encouraging patients to eat potassium-rich foods is a key part of treatment. Foods like bananas, oranges, spinach, and potatoes are excellent choices to help restore potassium levels naturally. Next, we need to review the patient's medications. Some drugs, especially diuretics, can cause potassium loss. It's important to identify these medications and consider adjusting them if necessary to prevent further depletion. Cardiac monitoring is absolutely crucial, especially in severe hypokalemia. Continuous EKG monitoring can help us detect arrhythmias early, which are a serious risk when potassium levels are low. We also have to keep a close eye on respiratory status. Hypokalemia can weaken respiratory muscles, leading to respiratory failure if not addressed promptly. Regular assessment helps us catch any signs early. In summary, effective nursing care for hypokalemia involves restoring potassium levels safely, whether through medication, diet, or both, and continuously monitoring for potential complications. Remember, safety first. Always prioritize patient safety throughout this process. Let's take a closer look at some of the conditions that cause potassium to shift out of the cells and into the bloodstream. For example, acidosis, trauma, or burns can all disrupt the normal cellular balance and lead to an increase in blood potassium levels. These shifts are important to recognize because they can quickly impact cardiac function. Now, moving on to medications. Certain drugs like potassium-sparing diuretics, such as spironolactone, ACE inhibitors, and NSAIDs, can all raise potassium levels. It's crucial to monitor patients on these medications for signs of hyperkalemia. Another key factor is excessive intake. This includes oversupplementing potassium, whether orally or through IV, or consuming large amounts of potassium-rich foods. The risk becomes even higher if the patient's renal function is impaired because their kidneys can't excrete the excess potassium effectively. And that brings us to the most common cause, kidney failure. When the kidneys aren't functioning properly, they can't remove potassium efficiently, leading to dangerous accumulation in the blood. Finally, hyperkalemia is defined as a serum potassium level greater than 5 mg/L. It's often more dangerous than hypokalemia because it can have rapid and severe effects on the heart, increasing the risk of arrhythmias. Recognizing these causes and risk factors is essential for early intervention and management. Paresthesias, which include numbness and tingling sensations, can also be present in hyperkalemia, along with irritability. These neuromuscular symptoms are important clues and indicate that the nervous system is affected. Moving on to gastrointestinal symptoms, nausea, vomiting, abdominal cramping, and diarrhea are quite common. These symptoms resemble those seen in hypokalemia, but can actually progress rapidly to more serious issues like flaccid paralysis. This paralysis typically starts in the lower extremities and then ascends upwards. In terms of muscle weakness, it's a key sign to watch for. The classic EKG changes associated with hyperkalemia include tall, peaked T waves, widened QRS complex, and in severe cases, ventricular fibrillation or asystole. These cardiac arrhythmias are life-threatening and require prompt recognition. Early identification of hyperkalemia is absolutely crucial because severe complications, especially those involving the heart, can develop very quickly. That's why monitoring signs, symptoms, and conducting thorough nursing assessments are vital components of managing this condition. Recognizing these key features early can make all the difference in preventing serious outcomes. Let's talk about emergency medications used in hyperkalemia management. First, calcium gluconate is crucial to protect the heart, but it's important to remember that it does not actually lower potassium levels. Next, we have insulin combined with dextrose, which helps shift potassium into the cells, temporarily reducing the serum potassium. Additionally, sodium polystyrene sulfonate, commonly known as K-oxalate, works by binding potassium in the gut to promote its excretion. Moving on to diuretics, specifically loop diuretics, these can be effective if the patient's renal function is adequate. They promote the excretion of potassium through the urine. For more severe, life-threatening cases, especially in patients with renal failure, dialysis becomes necessary to rapidly remove excess potassium from the bloodstream. Continuous cardiac monitoring is absolutely essential in all these scenarios. It allows us to detect and intervene immediately if dangerous arrhythmias develop. Another key point is to identify and remove the source of the hyperkalemia. This means discontinuing any potassium supplements and reviewing medications or dietary factors that might be contributing to the elevated potassium levels. Remember, immediate action is often required because hyperkalemia can have fatal cardiac effects if not managed promptly. This is a cardiac emergency, and prompt, coordinated intervention can make the difference between life and death. Now, let's talk about the different approaches to managing potassium imbalances. For cardiac protection, we focus on calcium, which helps stabilize the heart muscle. To shift potassium into cells, insulin combined with dextrose is used. And to remove excess potassium from the body, options include K-oxalate or dialysis. When replacing potassium, we can do so orally or via IV, and increasing dietary intake is also helpful. Next, let's look at the treatment focus. When potassium levels are high, we see increased motility, cramping, and diarrhea. Conversely, with low potassium, the GI system slows down, leading to decreased motility, constipation, and even ileus. In terms of symptoms, high potassium can cause muscle weakness, paresthesias, and ascending paralysis, meaning it starts in the legs and moves upward. On the other hand, low potassium causes muscle weakness, cramps, decreased deep tendon reflexes, and flaccid paralysis. Examining the ECG changes, hyperkalemia presents with tall, peaked T waves, widened QRS complexes, and prolonged PR intervals. Hypokalemia, however, shows flattened T waves, U waves, and also a prolonged PR interval. Finally, it's important to remember that the NCLEX often tests your ability to differentiate between these conditions and to prioritize your interventions accordingly. Recognizing these signs and understanding the appropriate management strategies are crucial for providing safe and effective care. Feel free to ask any questions to solidify your understanding. Your mastery of these topics is vital for patient safety. Think about how you'd apply this knowledge in real patient scenarios. When it comes to clinical application, remember the most critical interventions for both hypokalemia and hyperkalemia. Nursing priorities include recalling the distinct causes, signs, and symptoms for each condition. And let's not forget the key differences between them, which are essential for accurate assessment and treatment. To reinforce your learning, we'll do a quick review and open the floor for any questions. Remember, mastering potassium imbalances is crucial for safe and effective patient care, so don't hesitate to ask if anything isn't clear.